Hi, everybody. I'm Rachel Seward. I'm Deputy CEO of WACOSS, and I'm your facilitator today. Thank you for joining us. I'd like to start and kick off this webinar by acknowledging country, and I acknowledge that we are in Wajak Noongar Boodja. I pay our respects to elders past, present and emerging, acknowledging this land was never ceded and is in fact stolen land, and we have a lot of unfinished business. I'd also like to acknowledge that some of you, or many of you, will be coming from other lands in Western Australia, and I'd like to acknowledge the traditional owners of all the lands on which we are meeting today. We acknowledge and respect the fact that these lands, their waters, their land, waters and community that existed prior to colonisation, and we are aware that we are dealing with the ongoing impacts of colonisation, and show our deepest respect to elders and cultures of this great state and the lands that make up Western Australia. Today we have a great lineup of speakers for you. At the end of each speaker, we will have a time for questions, and then we have a short panel session at the end where the speakers will join us for any broader discussion. If you want to ask a question to one of our speakers, please put your question in the chat. We have a process where the chat will come up, and I'll then ask the speaker the questions. So without any further ado, I'll kick us off with our first speaker. Our first speaker is Lindsay Hale. He'll be speaking to us about public school funding and educational disadvantage. Lindsay is the school leaders consultant for the State Teachers Union of Western Australia. He's worked for over 3 decades in public schooling, in the classroom teaching and in school leadership roles in both the metro area and regional schools. Supporting vulnerable young people, strengthening regional services, the advancement of Aboriginal people and supporting public education have been a consistent throughout Lindsay's career. Most recently, he's held executive roles at the Department of Communities and the Mental Health Commission. He's also a staunch advocate for social justice, public education and joined-up human services, and to ensure that services are person-centred, place-based and trauma-informed and culturally responsive. I'm going to hand over to Lindsay. Take it away.
Thank you, Rachel. Can you hear me okay?
I can certainly hear you perfectly.
Right. Okay. Well, hope everybody else can. Look, thanks so much, Rachel, and thanks everybody for the opportunity. I'd just like to also acknowledge the traditional custodians of the various lands on which we're coming together, and also just reiterate the State School Teachers Union of WA's commitment to hearing Aboriginal voices and advancing Aboriginal people. So just on the Teachers Union itself, we're the union that covers obviously teachers, but also school leaders, school psychologists, and our regional directors, all of whom I'm sure many of you would have had some sort of contact with. As a union, we have always had, we just celebrated our 125th anniversary last year. In all of our history, like all unions, we've had one of our fundamental reasons for existing is to promote and protect the rights of our members. But also throughout our entire history, we've had a second fundamental purpose, and that has been the advancement of public education and advocacy for children and young people. So I guess the place to start here is, well, why am I talking to you and what's our common interest? Well, I think our common interest is this. Public education is here to serve everybody who wants to access it. And of course, there are very diverse people that do access public education. But our common interest, I think, is that public education is the place that most vulnerable children and young people are provided access to education. By far, most vulnerable young people, children and young people. And when I say most vulnerable, what I mean by that is the most disadvantaged, those with disabilities, those with challenges, health, mental health, well-being, those with complex behaviours, those impacted by trauma, including, of course, those impacted by intergenerational trauma, Aboriginal kids, refugees, survivors of abuse, children in care, especially children in residential care, and kids in contact with the justice system. And as you know, all manner of combinations of the above. So why, given that, why am I talking to you now? Well, the reason we're having this quick conversation at this point is because in 2023, the Teachers Union commissioned a review of public education. That review was led by Dr. Carmen Lawrence and a panel that included former Commissioner for Children and Young People and one of my former colleagues on the executive in education, Colin Pettit, and they landed their report in October last year. That report was very aptly named Facing the Facts. Facing the Facts, well, this is a document, an extensive document, that is really calling on us all to accept that whatever the intentions have been of public policy in relation to education, we've landed currently in a pretty unhappy place. It doesn't seek to attribute blame. The fact of the matter is the panel has looked at what's occurred over, say, 10 to 12 years. Both sides of government both sides of politics have been in power over that time. Both have led their various policy changes and, frankly, policy failures. And both have led through budget cuts to real reduction in the budget provided to public education, including to those most vulnerable kids. So the report calls on everybody to not seek to blame anybody, but to just accept the objective reality that where we're at is not where anybody rationally would want to be, that the system has got to a bad place, and it then spends a lot of time offering constructive, coherent, positive suggestions about, well, what might we do about that. It has 5 parts. The first goes through the extensive major educational policy changes, legislative changes, and so on over the last decade or so. The second goes to funding and staffing and the very serious challenges public education has faced and frankly that have only grown. It then, in the third section, goes to the social changes that have occurred over that time. How have student attitudes changed? How have behaviours changed? What have been the mental health and well-being impacts? And in particular, what have been the very serious impacts on early childhood development and therefore school readiness, so that many of our young children and young people start behind the 8 ball when by the time they've arrived at school, they are already significantly educationally disadvantaged. The fourth section then goes on to talk about, well, what's the impact of that on the people who work in schools, particularly teachers and school leaders? What's happened with workload, which has grown enormously in both volume, but more importantly, perhaps in complexity and intensity, and the impacts that's had on satisfaction, turnover, the teacher shortage, and frankly, on performance, how well the system is working. And that, of course, leads us to the final section, which is, well, if you put all that together, what is the cumulative impact on achievement for educational achievement for children and young people in our state, and their satisfaction, which frankly is not terribly good on the whole. So that whole report leads to 46 recommendations. It's based on a massive amount of consultation, face-to-face, public meetings, certainly with teachers and school leaders, but with parents, with advocates, with community members, quite possibly you or members of your organisations, and also a massive number of written submissions from a wide range of organisations with an interest in both public education or, more broadly, an interest in the well-being and the educational outcomes for children and young people in our state. The other important thing is it's not just based on that massive consultation. It's also based on, and you wouldn't be surprised, being led by Dr. Lawrence, there's a significant evidence base to the report as well. So there is significant research of policy documents, of various evaluations that have occurred, also noting where evaluations might have occurred and haven't, or have occurred and we've never heard the outcome. Research into the outcomes that we're seeing, and also drawing on the evidence that's available from a raft of academic papers. When you put all that again together, the essential message is that right now, children and young people are not being served well. Teachers and school leaders feel undervalued, disrespected, and exhausted. As I'm sure you know, many have left the profession. Many are reducing their hours in order to cope. Fewer people are wanting to join the profession. Our view as a union is, nonetheless, there are people who are sticking at it. We owe it to them, and we owe it to the children and young people that they serve to actually stand up now and say this really is not good enough. Nobody is suggesting that teaching and school leadership should be an easy job. It's always been a hard and demanding job if you're trying to do it well. But the system now and the profession now is at breaking point. And that's not just an issue for the people working in it, which of course we have an interest in as a union. It's also an issue for what does that mean for our communities, for our children, our young people. And paradoxically, these burdens have grown exponentially while the system support and the resources for system support have consistently been reduced and centralised. So we have a system now where the strategic directions within education are no longer clear. As ever, the strategic directions across human services are only clear in the most fundamental sense, but it's very hard to see serious collaboration on the ground. How can you possibly have that? And we know there is good collaboration on the ground, but that's almost in spite of systems. Where is the strategic leadership across government so that folks in the human service government agencies and folks like you, so that we can all work together to benefit children and young people? So support for teachers and school leaders has fallen away, along with their status, recognition and pay. And our schools are verging on crisis. And the people that are going to suffer most and are suffering most for that are our kids. The review does not suggest, as some people have said in the press, you might have seen, it does not suggest turning back the clock. It simply suggests let's face up to the reality and let's start having a conversation about what we can do practically to make things better. Because until we do that, children and young people will continue to pay the price. So what do we need? The report advocates a lot of things, but I'll give you a few key ones in a nutshell. Services and supports that are accessible and responsive and close, particularly in the regions. There is almost no support for public education in the regions now. And where there is, the limited support is not joined up with other supports. Real support for Aboriginal education. I was very proud, as were others, I'm sure, to be involved in developing some time ago the Aboriginal Cultural Standards Framework. There has been no concerted effort to support people in implementing that framework. Simple things that we could be doing within the education system and across government. For instance, why can't we have place-based, government-funded, ACO-led and delivered cultural responsiveness training provided in particular locations to all of the human service government agencies and not-for-profits that are working with those communities? Why is that so hard when it seems to be so obvious and would actually be a very cost-effective way of making change? The report is very strong on the fact that better support is needed for kids with complex needs and disadvantaged kids. And that means better support within public education, but it also means across other government agencies, and it means across your sector and all of us working together.
Lindsay, I'll just give you a 1 minute warning.
Okay, thank you. And so this is about things like adequate and accessible funding. It's about how we actually think about how we work better together. It's about really facing some of the facts of what's gone wrong here. I'll just leave you with a couple of quotes. A final quote from Dr. Lawrence herself in the report: "The teaching profession is calling for immediate and sustainable change to the public school system. The profession is at breaking point and requires immediate steps to support improved education delivery and morale." Further, she says the cumulative impact of frequent policy changes, including the increased isolation of schools generated by the IPS initiative, has steadily increased both the intensity and complexity of workloads, lowered morale, increased burnout, and created an environment where teachers feel undervalued, disrespected. Many teachers, particularly in disadvantaged schools, where of course that disadvantage compounds for young people, are paying a high personal price for staying in the profession. And the final quote I want to leave you with is not from the Lawrence report. Late last year, about the same time, another report was released. It was a report that the Minister for Education called for, that the Department of Education commissioned, and my favourite quote from that says this: "Our analysis indicates that the problem goes to the more fundamental question of whether the job of teaching as currently performed and organised is doable and sustainable. That is because people like you, people like other government agencies are under-resourced, so that an undue lot falls on the school, which is actually meant to be there focused on wellbeing and education, not all those other human services. This is not good for anybody. The reason we're sharing this with you now is we know that you are advocates for the sorts of things we're talking about. We would invite you to, if you have the opportunity, it's useful to you, have a look at the report. I'll send the link through to WACOSS. Have a look at the report, and by all means, if it's of any use to you in your advocacy, please, it's a strong evidence base. Please feel free to use it. And that's it. Thank you, Rachel.
Thank you very much. I've got a couple of questions rolling in. The first one is from Chris Toomey, saying, "Thanks, Lindsay, a great report. Our sector is very concerned about timely access to early childhood development services and school readiness. What did the report say were the practical solutions to this, and how do we get involved?"
Yeah, well, I think the main involvement is advocacy that we have to press. And look, this is one of the things we've been doing. We've been talking, not just, obviously we've been speaking to the Minister for Education. We've also been speaking to the Minister responsible for early childhood and all the other human services ministers. I think what we really need is to see that, look, the fundamental here is, don't we all know that it's similar to mental health and wellbeing issues for older kids as well. There's been a gross underinvestment in all of these things for many, many years. And I know from my time in communities and the Mental Health Commission in particular that WACOSS members have not seen resources keep pace with real costs or growing demand. I mean, that's the fundamental. We have to say, in a state, in a country as wealthy as ours, surely we can make this investment. And surely we can see that the cost to the whole society in terms of the harms that will be done to people and the consequences in terms of locking them up, having them, requiring more healthcare, mental health care, and so on, and the harms that occur between people as a result of these issues, there's a real cost benefit here that we have to face up to. I think that's the fundamental. So I think it's the resources, and then I think it's also joined up approaches where we really work together, not a handful of parent and children centres, not just one full service secondary school in the whole state, but actually facing up to the real need in our communities.
Thank you. And then the next question is from Evan Nunn. Great update, Lindsay. Are you in contact with James Christian on the joined up service approach with COSS? Rachel will know him. Okay, so this is about working with the Australian, the Council of Aboriginal Services Western Australia, CASWA. And so have you been talking to him? If not, I think Evan's pointing out it'd be a good idea to. and
Yeah.
also how is your experience with the Department of Communities?
Okay. Oh, that's you don't really have time for that. I'll have a go at it. No, look, to be honest, no, we haven't been in contact. We have been trying to speak to a number of people and groups that are advocates for Aboriginal people. So I've just made a note. I'll happily follow that up. That sounds like a very good suggestion. In terms of how was my time at communities? Well,
I suppose it's, yeah, how's your experience with, so how is it going working, you know, like on the education issues, I think is what is meant.
Look, I'll just say this, and this isn't meant, I'm not saying this to blame anybody, but I've spent a lot of my working life trying, at least on the ground, but also at a more strategic level, trying to get people to work together. And it's not often that you meet someone who says, well, that sounds like a stupid idea, but it's just enormously frustrating in getting people to do it. And I think, frankly, that's because there's not a core government position on this. So we've seen all those machinery of government changes, which you would think would have helped. But I was in charge for a while there for service delivery in communities. I felt as though I could only really get on important issues for individuals, really get child protection and housing to work together when the people on the ground just made up their minds, regardless of what the KPIs demanded of them, that they were going to do a bit of good by trying to join up how, for instance, housing might support a family with FTV issues. It's going to, if you don't do something about it, is going to lead to children being taken away. Now, why isn't that just the position? Why isn't that the goal? And why don't we just all own up to it? And everybody, this is one example, and there are countless others. And then we all wrap around, let's get behind this and get behind that family.
Thank you. I think I can squeeze very quickly, because we started a couple of minutes late, one more in from Kim I think it's Kim Robertson who's put this in there. Is there recommendations concerning universal access to childcare playgroups and how to build in staff, funding and infrastructure in WA?
Yeah, look, it certainly goes to that. There are recommendations in relation to that. And it does call on both the state and federal governments to work together on coming to proper funding arrangements for that as a significant part. And of course, the main thing it calls for in the report is that equitable access, no matter who you are or where you are across the state, because we know that that's just not how things work. And when you get into remote communities, it's really actually quite appalling.
Thank you. Hopefully you can hang around or come back for our panel session.
Yep.
I'm going to put a question on notice. Government made, and you probably prepared for this already, the government made an announcement about their in-principle agreement with the federal government around 100% funding.
Yep.
I think it'd be useful to hear your thoughts on that when we come back for the panel.
I will be very happy to share exactly, to try and clarify exactly what that does and doesn't mean. Thanks, Rachel.
That would be very much appreciated. Thank you. Unfortunately, it's really hard to hit clapping online. So everybody, maybe tend to do this or something for clapping when we're online. So we'll think about that later. I would now like to introduce our second speaker. Our second speaker is Libby Buckingham. She's the Director of Thriving Communities at WACOSS equivalent in Victoria, which is the Victorian Council of Social Services. Libby is, as I said, the Director of Thriving Communities at VCOSS. She works to foster a stronger community services sector and promotes wellbeing, inclusive growth across Victoria. Prior to this role, Libby was a senior ministerial advisor to the Deputy Premier in Victoria and has been a policy advisor in a range of Victorian departments specialising in social policy. She was a member of the first cohort of Teach for Australia and is passionate about creating a fairer society and is committed to building an excellent education system for providers that provides opportunities for all children. Welcome, Libby. Thank you for joining us. And I know it's much later over there, so really appreciate your being with us.
Thank you, Rachel, and thank you to WACOSS for inviting us to Zoom in to WA today. I found Lindsay's presentation fascinating, as I started my career as a teacher and have a real passion for education policy and obviously for the community sector over here at VCOSS. I do have a presentation, so I'm going to share my screen. Hopefully this can all be seen. Rachel, can you see that slide, Prezzo?
Yes, I will just take myself off mute.
Fabulous.
Yes, we can. Thank you.
Fabulous. So before I dive into our discussion about early intervention and prevention, I would like to begin by acknowledging that I'm zooming into you all from the lands of the Wurundjeri people of the Kulin Nation, and I pay my respects to their elders past and present. I acknowledge that sovereignty was never ceded, and we are coming together today on stolen lands. So I'm here to chat to you today about early intervention and prevention, and specifically about the early intervention investment framework that the Victorian government introduced a few years ago. VCOSS, along with WACOSS and our other COSS around the country, and our community and social sector colleagues have long advocated for a greater focus on early intervention and prevention. We believe that disadvantage is not inevitable, and in many cases, we have the tools and the knowledge and the evidence to prevent unfair outcomes. And we need long-term and sustainable investment to really turn the dial. In 2021, the Victorian government introduced the Early Intervention Investment Framework. I'll refer to it sometimes as the EIF. It's a long acronym. The framework has two key goals. The first is improving outcomes for users of government services by offering assistance and interventions earlier. And the second goal is reducing government expenditure by curbing the demand for acute services. The government has invested over $1.5 billion into the EIF and into early intervention and prevention initiatives through the framework. VCOSS has done a bit of work with the Department of Treasury and Finance and other government departments to consider how government can better collaborate with the sector on the initiatives that are funded through the framework. So my presentation today is my reflections on the EIF to date and how it can form a part of a broader system that addresses the drivers of social disadvantage. It isn't a silver bullet to all of the problems that Lindsay just described. It doesn't solve all the issues that we need to work collectively on, but it does provide some promise. The problem the EIF is designed to solve is one that will be familiar with all of you. From a government perspective, they are seeing an upward trend in demand for acute services, such as health, mental health, child and family services, and in the spending on prisons. As a share of revenue, the cost of these services is growing at quite a rate. From the government's perspective, unsustainably. From a service sector perspective, we know the potential of early intervention, not just as a way of saving money, but as a core part of our work and as a core way we can improve outcomes and the quality of life for people and communities. As I'll quote from an Aboriginal leader that has worked on an EIF initiative, that they already work upstream of what the government is talking about here. They have grown to deliver the social determinants of health, working to prevent and stop people from going into care, into the justice system and experiencing chronic illness. But this work of ACOs, like the person I just quoted, is often underfunded and often doesn't fit into the remit of one particular department. It really, again, to quote Lindsay, we really need to work together to address the root causes of disadvantage. The framework was set up in 2021 to respond to these problems. And it does offer a different way for services to be funded. The model ensures a focus on outcomes. It is designed to encourage departments to undertake more early intervention initiatives and to think in that space. So how does it work? With the support of DTF, departments, sometimes in collaboration with each other, but often still on their own, develop proposals for programs to be funded. The proposals need to include what outcomes will be achieved and estimates of avoided costs over the next 10 years. For successful proposals, outcomes are tracked over the course of the initiative. Some avoided costs are then reinvested into new initiatives. Some are retained by departments because the savings aren't fully realised in all cases. For example, where there is latent or unmet demand. The framework is seen as a growing part of the budget. There has now been over $1.5 billion spent on various initiatives throughout the framework. The initiatives are diverse, aiming to achieve a range of different outcomes from health to justice, housing and to education. For example, the $45 million program 100,000 Lives is designed to reduce preventable hospital admissions and reduce unintended harms. Journey to Social Inclusion, on the other hand, is a housing first model to reduce homelessness. Our next state budget will be handed down in just a few weeks in early May. In Victoria, we are operating in a very tough fiscal environment. The government keeps reminding us how to lower our expectations come May. This is, from what I've heard, is quite a different environment to what you're facing in WA. But we do believe, even given these tough financial times that we're experiencing here in Victoria, that the government is committed to funding these initiatives through the EAF and expanding the model further. And the Department of Treasury and Finance and the government has engaged with a range of organisations, including us here at VCOSS, but also a bunch of sector orgs, to iterate and improve the EAF and build the sector's and the department's capacity to engage with the framework. So what do we think about it here at VCOSS? And there are some big positives, but there are also areas of improvement. We see it as a big step in the right direction. With over $1.5 billion invested via the EAF, it shows that the government does take early intervention and prevention seriously. It means that government departments are now incentivised to be thinking and talking about it. Interventions that offer early help are seen as a critical part of the service system architecture. As we have always known, now that's really a theme coming through strongly in government. It also represents a shift about thinking about social services as an investment, one that has long-term benefits to the community and the government. And there is a greater recognition of the potential future costs of government not investing in social services that might make government think twice before cutting back. Another benefit is the focus on outcomes and the commitment to measurement and evaluation. There is some concern that this adds to the reporting and administrative burden of service providers. But there has been investment in building sector capacity. For many sector organisations, having effective data collection processes, tools and capacity to evaluate programs is a big barrier to accessing funding to programs. For many, they are doing something that they know is working, but they don't have the evidence to demonstrate it. This year, the government opened a $2 million empowerment grants fund to help lift the barriers that the community sector faces when it comes to data collection, evaluation capabilities. And this will help the government and the sector collectively build the evidence base on early intervention and prevention and what's working for who and why. So there's some of the positives around the EAF. There are areas for improvement. One of the sort of areas for improvement is that it's established on the premise that partnerships are critical one of the positives is that partnerships are critical to solving complex social problems. So I've actually skipped ahead here. No, I'm back on track. So the last positive thing that we want to emphasise is that it does build partnerships, and that it does focus on outcomes that often can fall between the government silos, and it incentivises working together between service providers and government departments. The conversations that the department and DTF and sector orgs are having around measurement and understanding outcomes is enabling mutual learning in both government and the sector.
Libby, while you're moving forward, I'll give you one minute.
Oh no, I've got so much more to say. I'm going to have to push through very quickly. So if I've only got 1 minute, in terms of room for improvement, because I know that a lot of people look to frameworks like the EAF as a solution to all things. One of the challenges we've had is that there is no consistent agreed definition of early intervention and prevention. Some of the investment has gone towards initiatives that we would think of as late intervention. For example, investment into programs once people are in prison, and we would argue that if it's truly preventative, it would be before people are in custody. There is still challenges around collaboration and breaking out of our traditional silos, and bringing together the diversity of perspectives. Stakeholders need to be involved early in the intervention design, and there are a number of ways government can make this happen. I'm going to fly through so that we can have some questions. Having mechanisms for collaboration across sector and government silos helps to ensure that the proposals address the cause and not just the symptoms of issues. As one sector leader put it, collaboration is really about having a common agreement and deep assessment of what the problem or the issue is from the outset. So involving communities and practitioners and organisations early in the process, ideally co-design, would lead to more innovative and new initiatives. Ultimately, we see the EAF as a very positive step forward, but we still maintain that it needs to be part of a bigger vision for how we do budgets in Victoria. Here at VCOSS, we advocate strongly for a wellbeing economy approach and wellbeing budgeting. We've seen movements at the federal level around what matters, measuring what matters, and New South Wales just introduced a wellbeing budget framework. And we think while the EAF has got a lot of potential and is funding some excellent initiatives, it's not enough to just fund in a fragmented way, that we need a wellbeing budgeting approach to have a holistic approach to really addressing early intervention and prevention. And that while the improvements in measuring outcomes and building the capacity of government departments and the sector is a really fantastic step towards that, we still need investment in mainstream services. We need system design, system reforms, if we're really going to shift the dial. Rachel, I whipped through the second half of my presentation very quickly so I could take questions. I'll stop sharing.
Thanks, Libby. And I'm sure some of those points will come out during the questions session as well. So I've got a couple of questions here, one from Evan. Did Treasury and Finance leaders back this in from the beginning, or did they get rolled? And there's a supplementary as well. Is this working overseas for other wealthy or less wealthy social democracies or states within those nations?
So the first question, I don't know the inner workings of how it was in the early days. But what I can say is that the social policy part of DTF has taken a real lead in working with the sector and other government departments on how to actually do it. You know, it is a new way of writing a budget grid, designing an initiative. And obviously there's still room for improvement and depth on that, but, you know, they have led, you know, they brought us together, sector leaders and government leaders from across the different departments together in a summit late last year around how we can continue to improve the framework, continue to work together, continue to build the capacity. And then they announced that that $2 million capacity building fund, the empowerment fund. So DTF has definitely led it and backed it in. And about other international places, my understanding is that it's pretty groundbreaking what Victoria is doing, and that it's really designed the model here in Victoria. We do know that other jurisdictions are doing a sort of streaking out ahead of us around wellbeing budgeting, and that there are methods and approaches from overseas around that more holistic approach that I mentioned at the end that I think we could definitely learn from and pick up.
Thanks. And Chris says, thanks, Libby. How did you get the Victorian government support in the first place? What were the critical levers? You know, here in Western Australia, we've been talking about the need for this for a long time, so we're eager to learn. That was my editorial at the end.
Eager to learn. I think, you know, VCOSS, WACOSS, we've been advocating for so long for early intervention, and we know, often anecdotally, often we have the evidence and the data that it works and that it makes sense and that it's the right and humane thing to do. I think the shift was that the government really started to think about it as an investment, that if you put the funding in, the $1.5 billion since 2021 will come back. Will come back in lowering that acute service demand. I also think that demand for acute services is going through the roof. So they needed initiatives that will break that cycle. And so it was very much, you know, we focus on it because of the potential it has for outcomes for improving people's lives. I think the government really picked up on the cost saving part of it, which, you know, initially we were quite nervous about, and we're still, you know, they're reinforcing that we don't just measure cost savings, we measure, you know, people's health, and we need to measure people's well-being. It's not just about cost savings. And so we're very keen to keep the focus on both of those elements.
I've got another question from Fiona. Given the diverse range of challenges individuals and families face, how does the EVE prioritise equitable access to support for all communities, in particular marginalised people?
I think this is a really good question. And I think the nature of the initiatives that are being picked up focus on people that are extremely marginalised and that are users that do use a lot of acute services a lot throughout their lives. So, and what it does is, what it has the potential to do is, rather than looking at, oh, you know, hospital admissions, a health problem, and young people not coming to school is education's problem, it actually looks at that individual family or that individual child, and rather than saying, you know, this is health's problem, this is education's problem, it's actually like, how can we improve that child's life through this initiative? So it does have the potential to break down those silos and reach those people that need support the most, potentially. But that really comes, and we've still got work to do here on like the quality of the intervention and the quality of the initiative. And if it's just about preventing emergency room, you know, people turning up at the hospital, it won't fulfill its promise. that it really needs to look at those people with lots of different challenges and the intersectionality of disadvantage here in Victoria and that complexity.
Thank you. I could sneak in one more question if anybody's got one last question. Okay. It doesn't look like any are coming through in the, oh, sorry, one last minute one. For how long a period?
Is that how long do they measure the outcomes? I presume, I think 10 years.
Right. Okay.
Yeah.
Okay.
How long the window is.
Thank you very much for your time today. We really appreciate it. We're really keen to keep following, actually. Certainly WACOSS will keep following what's going on in Victoria and see the best bits we can take out. We might be back in contact about some of those other things that you're seeing as it rolls out. What are some of those other issues that you've flagged that you see as particular areas that aren't going so well or problems?
Wonderful. Thanks, Rachel.
Thank you.
Bye.
Bye. I'd now like to go to our third speaker, Isabella Choate, who is the Interim CEO at the Youth Disability Advocacy Network. Isabella is an award-winning lived experience advocate working across the spaces of disability, mental ill health, LGBTIQA+, and youth spaces. They are passionate about recognising and celebrating intersectionality and prioritising lived experience in leadership. Please welcome Isabella.
Thank you
Hi,
so
Isabella.
much, Rachel. Hello. Can everyone see my screen?
Yes, it's in presenter mode by the looks of it, though.
Okay, well, we'll take that off then. New slideshow. There we go.
There we go. Perfect. Thank you.
Thank you. Hello, everyone. My name is Isabella Choate. I use they, them pronouns. And as Rachel kindly said, I am interim CEO at Wyden. I was Young Person of the Year last year. And I'm going to be talking about young people in the workforce from both my lived experience and also from my position in management. So a little bit of a visual description of me. I am a tanned Asian person. I've got brown hair and a bit of a fringe. And today I'm wearing an orange striped shirt. So just to lay the context, what we do know, and I believe this follows on from a presentation at last year's Emerging Issues about the state of the workforce. But what we do know is that there is a workforce shortage in the community sector, and the community sector is aging. So one of the solutions there is that we need more young people. So I'm going to try and answer the questions: how do we be more inclusive of young people in the sector, and how do we attract more young people to the sector? And I think that rather than going at it as a really broad, how do we solve that? I think that we ask the question, what are young people's experiences in the community sector right now? What are the gaps that are missing? And how do we support people into this sector? So I want you to reflect and think back to when you were a young person. And I want you to think about all of the feelings you might have had coming into this sector. Then I want you to add on the experiences or the lived experiences that many of us probably have. So experiences of discrimination and disability, including mental ill health, and a lot of young people who are wanting to access the sector have lived experience. And so what this looks like for a lot of people is they're actually going to have less workforce experience than their peers at the same age. So this could be for a number of reasons. It could be because the young person has had to prioritize their health or their disability. It could be because whilst they were prioritizing their health and disability, they were unable to get any work experience. And then as they started to age, they had an empty resume, and so people continued not to hire. So we've got this sort of experience where we're a young person, we're a bit unsure of the world, we're a bit unsure of the sector, and we've also got these intersectional experiences that we might be experiencing. So then I wanted to map out a little bit, what is the brain of a young person at work? And if we hold on to those feelings that we were talking about just before, or we were thinking about, I've got a few of them around the place. So we've got, what are the social expectations? What are the pre-existing relationships in this space? You're a young person, you're coming into a pre-existing organization, and you don't really know what the norms are for this org yet. How should they dress for the meeting? There might be these professional standards that people are unaware of. So part of our role at WIDAN is not only are we supporting young people with disability through our programs, but we also support young people with disability through our staff. So we're 100% people with disability and 95% are young people with disabilities. And one of the things we found was that for many of these people, this is their first professional experience. And so a lot of them were questioning, I don't even know what to wear, let alone how to present myself in this meeting. Other things that are very common in our sector is, what are these acronyms we're talking about? I know even though I've been in the sector for a while, there's still acronyms I come up against that I have no idea what they mean. And a lot of young people will not have big picture thinking. This might be their first job, it might be their first professional job, office job. And so, they might be told, okay, we're going to do this in our project, but have no idea about the workings behind the scene on why this decision has been made. People might not be confident to ask for help from others because they don't want to be seen as young and inexperienced. They want to present that they know what they're doing. And so often that, they'll keep those questions to themselves. They might not know about the workplace's attitude towards upskilling, and they might have been promised certain upskilling, but don't know how to follow that up if it doesn't come through. A lot of young people don't know about career progression because they're not sure of their own job and how that job role plays a role within the whole organization. So they don't know where they might want to upskill or go next. People might not know their rights, and so they might not understand whether or not their managers are actually allowed to ask them to work with short notice or through their breaks, etc. And also a lot of young people are not confident in being able to ask around questions that would help them, again, progress their careers. So they might not be comfortable asking why I was turned down for that opportunity, or why maybe someone else has been prioritized as team lead for this project. So I'm just sort of laying the groundwork to showcase how many things young people can be uncertain of in the workplace. So if we start to draw out the themes, we might see that young people might not know about their workplace rights. They might not know how an organization works. They might not understand how to read their pay slips, what professional standards are. They might not know the language or the jargon of the community sector or, the organization itself. And they're unsure of the social expectations. Now, individually, these things might not seem like that big a deal. But then we start to see all of these problems that grow out of this. So if a young person isn't sure of their workplace rights, they are much more likely to be exploited they're much more likely to be exploited and not necessarily know where to go or who to talk to about their rights. If they're unsure of how an organization works, then they don't have the big picture thinking. And so, what seems to be maybe you're in a meeting and you direct your team to start taking a project in another direction. And all they're seeing is, we've been working on it going in this direction for the past 3 weeks, and now we're suddenly changing direction, and I have no idea why we're doing that, and there's no transparency around that. If people aren't told how to read their pay slips, aren't told what gross and net pay is, what pay G is, what their super is, then they're unlikely to be able to see if they've been paid incorrectly or not, and they're not going to follow up on whether they're actually being remunerated correctly. If people are unsure of professional standards, they're often going to miss out on opportunities to progress. And some of these might be because, they're participating or they're engaging and behaving in ways that don't align with professional standards, but actually no one ever sat down and said, hey, this is a standard that we hold ourselves to in this organization. And so people might be missing out on opportunities to progress simply because they do not know what standards they are being held against. If people don't understand the language and the jargon, then they're not able to participate fully. They might be sitting in a meeting and quickly Googling some words, or, if it's not explained to them in a language that they can relate to, then they won't be able to give their feedback, even though their feedback is probably quite valuable. It's just not in the same language. And lastly, if someone isn't sure of the social expectations, they're going to lack confidence. And lacking confidence in your workplace will likely lead to isolation. It might lead to people quitting, leaving the sector, and just feeling quite alone in their experience in this organization. So how do we turn being unsure into being sure? And these are just a few ideas. There are so many more ideas, and there's so many ways to be creative around this. But it really comes back to talking to your young people and starting from a clean slate, not assuming that they know, the professional standards or they know how to behave in the workplace. So, for example, if someone is unsure of their workplace rights, we could have an upskilling session. We could have a one-to-one session where we actually go through talking about what your rights are, where to find them. Maybe you go through an example of a complaint process, because we know that if people feel comfortable in providing feedback and knowing where to go, then they can utilize these services when they arise. But also, if you're having open discussions about this in your workplace, then you're more likely to catch where people are uncertain, or when people might feel that their rights aren't being met, you're more likely to catch them before things escalate. If you're having these open conversations about these are your rights, and I want to hear whether or not you feel that your rights are being upheld, then you're not going to have people, who are isolated and go straight to Fair Work, and then suddenly you had no idea that this person wasn't feeling safe, or that their rights were being upheld. You can also have an HR frequently asked questions, and that's something that we do at WIDAN. We have so many questions, which some of them might seem really simple. So it might be, again, how to read a pay slip. What does annual leave mean? What does personal leave? When do I take personal leave versus annual leave? All of these questions we have in one space as a frequently asked question, and that way people can engage and ask those questions without feeling embarrassed that they don't know.
Isabella, I'm just giving you a 1-minute warning.
Oh my goodness, what's going on? I chat so much. All right, well, let's get through this then. I'll leave this up and I won't talk through all of the different ones then, but I did want to pull out some that really work well for us. So social expectations, having social scripts, we have found really important for our staff, not only for staff with disability, but for everyone. So social scripts might be you're in a meeting and the meeting is going overtime, and your young person doesn't know how to communicate that meeting is going overtime. So if you have a pre-written script that they can utilize, then they can not only move the meeting along, but they can also feel confident in how they're doing it. The other one that I'd like to pull out is sector glossary. We have an ongoing corporate lingo and sector glossary that we use all the time to deal with those acronyms, to deal with slight variations in language, especially when people are coming from lots of different lived experience backgrounds. And lastly, if you feel like you're engaging with a young person and you're like, why are they behaving this way? Like, what is going through their mind? They have no idea how to act in this professional setting. Maybe take a step back and say, maybe they don't know what standards I'm holding them to. And maybe we need to have a discussion, open discussion around that. So I'll really quickly whiz through young people's needs and values. So people are looking for flexibility, financial security, sustainable work-life balances. They're looking for people who speak the silent parts out loud. So that's, again, going back to, if you ever find yourself judging someone for something, maybe flip that script and be like, maybe they don't know what I am actually judging them against. Some of the workplace trends at the moment is that people want to work flexibly. They want to be, they're very values driven, Gen Z workers. They're committed to their lives outside of work as well. So you often see memes of people just being like, I've shut my laptop on 5 on the dot, prefer to text or over call. So knowing the trends or how Gen Z wants to participate in the workplace is a really good starting point for engaging Gen Z. The ways that we align people's needs and values with the Gen Z workplaces, some of them are, we have flexible start times. So we have what's called a hard start time. So for example, mine is 11. And it means that I will often start working way before 11. But if I'm having a really difficult morning with my health, then I know that my meetings are scheduled after that hard start time and I'm going to be okay. The other thing is discussing the big picture and being transparent about all decisions. So even if the young person isn't engaged directly in those decision-making processes, I'll tell them about why we're making those decisions. Since we're going through so quickly, I will move on and just say that the way that we answer the questions, how do we be more inclusive and attract more young people to the sector, are the same answers. We need to make sure that we're setting people up for success. We're talking about the silent parts, and we're remembering that there's no guide on how to work that young people receive. So a lot of the times you'll have to be that person who talks them through and helps guide them. So yeah, the takeaways is there's no how to work guidebook. Don't assume young people know how a workplace operates. Don't underestimate the confidence, the power of confidence in young people. There are many ways to support young people in the workplace, which can be creative and fun. And make sure you're asking the needs of your young people. Ask them of their dream approach to work and see how you can best suit that. I'll wrap up now and I'll see if there's any questions. Oh, Rachel, I think you're muted.
Everybody has to do that. We have to do that at least every webinar. So now I've done it, so nobody else needs to do it. Okay, we've got a question from Evan. So great. Are we able to have this presentation made to our clients or for our programs and youth homelessness services team so we can share with young people who we are supporting into workplaces in Bunbury and the Southwest? Loved the corporate glossary. I need that.
Don't we all, right? Like there's so many things that like people will say and I'll be like, I've been in the sector and I have no idea what you're talking about. Yes, we can absolutely do this presentation for you, Evan. If you wanted to reach out to the WACOSS team, I'm sure they would be happy to pass on my details and we can sort that out.
Absolutely. I'm sure Evan's got our contacts. And then Chris asks, thanks, Isabella. Recent Bankwest Curtin Economic Centre report showed no improvement in employment for young people with a disability after over the last 2 decades. School to work transition was the biggest gap. So how can we help as a sector with the first job or placement? Is there a way to outreach into schools?
So really interesting question and very complicated answer, I suppose. There are programs that support the transition from school to the workplace, but a lot of those programs aren't meeting the specific needs of young people with disability. So, for example, one of my colleagues was in a program, and they are an ambulatory wheelchair user, and so when the employment service or the transition service saw that, they immediately assigned them to Kmart, because they said, okay, well, you're using a wheelchair, so you can do packing. And so there's no sort of discussion beyond that of, placing people in work that is meaningful to them. A lot of it is based on access needs and which organizations are going to take on those access needs, if that makes sense. So a lot of employment is and a lot of disability employment services in particular are keen to get people into work, but not necessarily a career, not necessarily work that they want to be in. It's more get a job so that you can be a part of the employed sector. So I think that, let me just get your question back up again. I think that as a sector, the way to help with that first job or placement is really to start from the basics, with a clean slate. Whenever you have a young person with disability or a young person in general in an internship or in their very first role, start from the beginning and think about every single thing that is assumed knowledge in a workplace and make sure that they're up to date with that. I think it was 2 years into working with my colleague that they were like, I don't know what leave is. I don't know how to ask for it, because a lot of young people have been working casual jobs. And so when they come into part-time work, they don't know that they're entitled to leave. They don't know that they're entitled to breaks and all these sorts of things. So I guess a multifaceted answer of, firstly, transition programs need to be meeting the needs of the person rather than meeting the bare minimum of their access. Secondly, the sector and organizations in general need to be aware of, the missing information or the missing knowledge and fill that in a very gentle and encouraging approach. A lot of people, if young people ask a question and are immediately faced with, you should already know this, they're not going to be wanting to ask questions again. Yeah, I think that's my answer.
Thank you. Anybody else with any questions? Doesn't look like it, but if people want more information, they can reach out to us and we'll pass on Isabella's contact details. I suspect you may get quite a few requests for workshop type of workshops or to be speaking with organisations.
Thanks so much for having me, Rachel.
Thank you so much. I hope you can join the panel shortly. Thank you. I'd now like to move on to our fourth speaker, who's Ollie J, who's going to be speaking about the heat impacts on prescription and recreational drug use. Ollie is Director of the Heat and Health Research Incubator in the Faculty of Medicine and Health at the University of Sydney, and currently holds a National Health and Medical Research Council investigator grant. He has led several large-scale projects that have directly influenced international public health heatwave policies internationally. He has also led extreme heat policy development for Sports Medicine Australia, Tennis Australia, in brackets Australian Open, and Cricket Australia. In 2021, he co-led the first ever series on heat and health in the Lancet. And to date, he's published over 200 peer-reviewed publications in journals. And of course, given our temperatures that we are facing around the planet, this is an extremely important topic. Ollie, just to let you know, your slides are on presentation mode. That's it. Fantastic. And welcome and thank you for joining us.
Thank you so much. Just want to confirm you can hear me okay?
Yes, we can. Well, I can.
Okay.
I think that means everybody else can.
Okay, then. So I'll crack on then. So thanks so much for that introduction. So today I'll just briefly talk about human heat stress risk and just briefly touch on some work that we've done recently looking at the evidence supporting the guidelines that are currently available on the impact of prescription medication or over-the-counter medication on the ability to thermoregulate in the heat. So I'll kick off by just defining a few key factors. And this is really important for understanding what actually determines heat stress risk for a person in a given environment. Often we are quite preoccupied with the temperature. This is the value that we typically get on a weather forecast or on our phones through apps. But what a lot of people actually miss is that this temperature is actually measured in the shade. So if you have people, particularly in an outdoor environment in the middle of the summer, in direct sunlight, the types of temperatures that they'll be exposed to will be much higher. So they'll be getting an additional thermal load due to solar radiation. And we measure that with something called a black globe thermometer to determine something called mean radiant temperature. And in addition to ambient air temperature in the shade, which drives convection, mean radiant temperature, which defines radiation, there's also two other environmental factors that really matter. Humidity, which influences the ability of sweat to evaporate, and then also wind speed as well. So the rate at which air is flowing across the skin surface really it modifies the effect of those other three environmental parameters. So those are the four environmental parameters that define heat stress risk. It's not just temperature, it's mean radiant temperature, humidity, and wind as well. And then even for a given fixed set of environmental conditions, there are two personal parameters that define heat stress risk. Simply what the person is doing, so the amount of metabolic heat they're producing inside their body, which goes up linearly with oxygen consumption, and then also the types of clothing they're wearing, which probably makes sense because clothing acts as a barrier to heat dissipation from the skin surface to the surrounding environment. Often people really focus on insulation of clothing, but in the heat, the main thing is the evaporative resistance, and that's not necessarily so how permeable a garment might be to water vapor traveling through it. And that's really the key characteristic of clothing in the heat that really determines heat stress risk. Just to give you a quick idea as to what these environmental parameters might look like on a hot summer day, these are data that I collected just with a device back in 2017 now, it seems like yesterday, but over 7 years ago. So at the start of January, so the middle of our summer here in Sydney. And in the shade, the temperature of the air was 39.1 degrees Celsius. But look at that black globe temperature measurement. That was nearly 53 degrees Celsius. So it really gives you an idea of the additional heat load that the body is subjected to that isn't reflected by the ambient temperature that's reported on weather forecasts. And then you'll have different wind speeds and humidities as well, which then exert a modifying effect on the human body. So physiologically, there are two main ways in which we try to defend body temperature. There's a process called a cutaneous vasodilation. This is simply where the blood vessels in the skin dilate, and that enables us to redistribute warm blood away from the body core towards the skin surface. And this then supports heat loss at the skin surface. And then in parallel to that, we also secrete sweat from our eccrine sweat glands. And the distribution is slightly different across the body, on the front and on the back. This is a really nice paper by Smith and Havenith that was published 12 years ago that demonstrated how that regional distribution looks. And it's not just the production of sweat, or it's not the production of sweat that keeps you cool, it's the evaporation of sweat. And that sweat evaporation is really modified strongly by ambient humidity, but also wind speed as well. And so you have these two different physiological ways of defending body temperature. And obviously, if you have a physiological impairment to either or both of those physiological responses, then you can imagine that somebody's going to be at a greater heat stress risk. But it's not just the physiological vulnerability that determines heat stress risk. It's also our behavioral capacity to adapt to a hot environment. And this is illustrated how these two things combined in this particular slide here. So we might have a certain environmental heat stress, which is defined by those 4 environmental parameters I described before. And then we'll have a certain physiological capacity to cope with that heat. And then in addition, we'll have behavioral adaptive capacity. And that behavioral adaptive capacity means that we are able to slow down, we're able to seek cooler environments. A big determinant of this is our mobility, but also our access to resources. And so if we're elderly, for example, or if we're immobile, plus if we're living in a circumstance where we're living in a low resource environment, we don't have access to cool spaces, we don't have access to air conditioning. One of the things that has been really evident this past summer is that some people who are on low income have access to air conditioning. In fact, they own an air conditioner, but they don't want to operate it because they're so concerned about the costs. So we really need to think about this in a holistic way. It's not just environmental parameters that define our heat stress risk. It's not even just the physiological components like aging, like having chronic diseases that define our risk. It's when that's combined with the living situation and the access to resources. And it's this combination of these risk factors that determine overall heat stress risk. So just on this next slide, I want to briefly touch on what actually goes wrong inside the human body when we are exposed to extreme heat. Traditionally, we think of the negative effects of extreme heat being characterized by heat stroke. So this is where we have a critical increase in body temperatures to the point where we have a resting core temperature of about 37 degrees Celsius. But if we reach core temperatures of above 40 degrees Celsius, there's a much greater risk of heat-related illness. And then if that still keeps going up to 41 or 42 degrees Celsius, the chances of heat stroke are greatly amplified. Now, very briefly, the mechanism behind heat stroke is that we're redirecting that blood away from the body core towards the skin surface. This deprives the endothelial tissue of the gut of blood flow and therefore oxygen. When that low oxygen delivery to the gut is paralleled by high tissue temperatures, such as 41 or 42 degrees Celsius, that endothelial barrier becomes leaky. So the gap junctions usually stay tightly shut, but they start becoming slightly looser. And this means that endotoxins that usually reside inside the gut can leak out across the endothelial barrier. Those endotoxins then enter the circulation and set off a cascade of effects that result in mass coagulation around the body, multiple organ failure, and ultimately death, which is pretty grim. But it's not just heat stroke that is what we need to be worried about in a heat wave. In fact, what we see from the epidemiological evidence is that heat stroke is responsible for the minority of heat-related hospitalizations and deaths during heat waves. The number one risk factor is cardiovascular disease. And the reason that people with cardiovascular disease really suffer in the heat is not necessarily because they can't keep critically cool. It's because of the extra cardiovascular work that is required to maintain body temperature through that vasodilatory effect. So again, we're redistributing that blood away from the body core towards the skin surface. If that wasn't compensated by an increase in cardiac output, so the amount of blood that's pumped around the body every minute, our central blood pressure would drop, mean arterial blood pressure would drop. Consequently, we need to increase cardiac output. Cardiac output is the product of heart rate and stroke volume, so the amount of blood that is ejected by the heart every beat. That goes down, if anything, when we're hot, because the pressure with which blood returns to the heart goes down. So this means that in order to increase that cardiac output, our heart has to contract many more times per minute. In fact, it's not unusual for a person who's exposed to extreme heat, passively sitting on a chair, to see their heart rate almost double when they're exposed to this extreme heat. That's without any physical activity. That's simply just the extra cardiovascular work that's required in order to maintain blood pressure. If there's an underlying cardiovascular infirmity, that becomes problematic because then there's a much greater risk of cardiovascular collapse. And this is why we think that in extreme heat events, cardiovascular disease is a number one risk factor for heat-related hospitalization and death. Finally, there's dehydration. So we're sweating. We can sweat by as much as 1 or 2 liters per hour. If we don't adequately replace those fluids, we have a progressive reduction in blood volume, which is a characteristic of dehydration. This is particularly pronounced over multiple days of extreme heat exposure. And this is why a heat wave is often defined as a minimum 3-day extreme heat event. With this dehydration, it can place extra strain on the kidneys, but it also aggravates the risk of classic heat stroke because our ability to sweat goes down when we become dehydrated. And also with that dehydration, a reduction in blood volume means the heart has to do even more work in order to maintain blood pressure. So the risk of cardiovascular collapse is amplified as well. So those are the underlying causes of heat-related hospitalization and death during extreme heat exposure.
Ollie, 1 minute warning.
Okay, right. Okay. So I'll just quickly get onto the medications. So what we see with the medications is that the World Health Organization, they recommend that there are 11 drug categories that supposedly interfere with thermoregulation. What we actually find is that in the document itself, there are no academic references supporting either the evidence that medications impair thermoregulation or the mechanism of impact. So we did a systematic review, which is led by my PhD student, Lily Hospers, and my colleague, Georgi Mavros. I'm just showing you this to simply show that it was a very thorough analysis of the literature, and this as well to show that we did a very detailed systematic analysis, meta-analysis. The summary of evidence is that related to those recommendations is that from an anticholinergic drug perspective, we actually only find that there's evidence of very strong anticholinergics impairing the ability to sweat sufficiently for it to influence how hot you get when you're exposed to a hot environment. We can separate anticholinergic drugs into 3 risk scores: anticholinergic burden 1, which is a low anticholinergic, 2, which is a moderate, and 3, which is severe. It's only ACB3 anticholinergics that impair thermoregulation according to the literature. There is some evidence of anti-Parkinson's agents interfering with thermoregulation and epinephrine as well. In terms of beta blockers, non-selective beta blockers only seem to impair with the ability to keep cool. So what we also find is that there's no evidence currently supporting claims of the impact on thermoregulation of all the other WHO listed medications, which is really important because the WHO currently recommend that GPs should consider adjusting dosages of these listed medications for patients if they are going to be experiencing a heat wave event. So the underlying evidence supporting that is very weak or non-existent indeed. Okay, I will stop there because I've run out of time, but I'll be happy to take any questions.
Thank you. I'm glad about that because I have some questions, that is. I've got a question from B who asks, has there been much research from UQ into heat impacts on First Nations people, specifically given the disparate overrepresentation of health outcomes they face?
So there's some excellent work by a doctor called Simon Quilty. He published some work in Lancet Planetary Health at the end of last year, trying to really demonstrate heat. Well, part of it were heat-related impacts in First Nations communities in Australia. So I would recommend looking up Simon Quilty, like a quilt, but with a Y at the end. And he's the lead author on that work, and it's a very respected work. And we're actually starting to collaborate with Simon and his team in the Northern Territories.
Thank you. And then I've got Anonymous. Hi, Ollie. Is there a problem for people who are more vulnerable to heat with the way that we define when it is a heat wave? Is there a better way to give warnings to those at risk?
Yeah, well, I had some slides to talk about that, but I ran out of time, unfortunately. The University of Sydney worked with the New South Wales government this summer to develop something called the Heat Watch app. This Heat Watch app enables users to enter information that defines their own personal situation. So you can enter what age bracket you're in, if you're on certain types of medications, if you have a certain chronic disease. It then automatically links to the weather information in where you are. And then what it does, it generates a personalized heat stress risk rating for you, and then also gives you evidence-based advice on what you can do to mitigate that risk. We also offer a 7-day forecast with that app as well. So not only do you know what your risk is now or what the risk is going to be peaking at that particular day, you can actually see that 7 days in advance to plan your activities around it. And what we find is that that's a much better way of helping people understanding their individual level risk. The Bureau of Meteorology do a great job with their forecasting, but the model that they use is really at the population level. So, but what it doesn't pick up on are these individual vulnerabilities, which you can define using this app. So the Heat Watch app, it's actually a web tool. So if you go to Google and you put Heat Watch Sydney, that will be the #1 hit.
Thank you. And I've just got B saying thank you. And she did mean University of Sydney, not UQ.
No, that's okay.
I did, and apologies. I just want to go to the point you just made just then in terms of the app. It seems to me that that would be a useful tool for community services that are supporting people that are affected by high heat to encourage their the people that they're working with, their clients, to use. It may, although for some people it may require some tech support to be able to use. And I'm just seeing that that's just been put in our chat.
Yeah, I'll just show you this again. This is the slide I was going to show. So there's a QR code on the right hand side. If you do that, scan me, that will enable you to access it. And it's still a tool that is under development. So we were trialing it this summer. We initially intended to trial it in Western Sydney, but it was so popular that people across Australia were using it. So we're integrating that information, getting user feedback, and then subsequently going to be rolling out a new version of it next year. But sorry, yes, in terms of, so we're trialing it a little bit. So we've had some discussions with New South Wales Health about using this as a means, as a preparedness tool. One of the main ways it's being used as a preparedness tool this past summer here in Sydney is that we've got a researcher, Dr. Tim English, who's part of my research centre here, and he's leading some work looking at developing pop-up cooling hubs for people experiencing homelessness. And that's been a very successful pilot study. But one of the big questions for them is, when do we deploy the pop-up cooling hub? And so they've been using the Heat Watch app as a means to understand, to plan in advance when they should be deploying, and also give them enough lead time to actually prepare as well, because there's quite a lot of preparation work that is required in advance of their deployment. So it's proved quite helpful for them in that regard.
I could sit here and keep asking you questions. Does anybody else have any other questions? Because I do have one more. Can't see it coming in, so I'm going to jump right in. In terms then of for pop-up hubs, would that then be it's then separated?
Oh dear, I've lost you. Well, while we're waiting for our host to rejoin us, maybe I can just quickly go through my last two slides that I was going to show everybody. So may as well, yeah. So the question is, of course, is what do you do when it's an extreme heat event? And so I just want to draw people's attention to the Lancet series that we published in 2021 on heat and health. And associated with that Lancet series, we had an infographic that summarized the scientific evidence underpinning the activities that people should be employing to reduce their heat stress risk when they're exposed to a heat wave. The challenge has been to date is that a lot of public health heat wave warning systems have activities or heat protection advice that people have been recommended to use, but it's not been underpinned by scientific evidence. This has led to quite a lot of old wives' tales and conventional wisdom to make their way into public health warning systems. And so we wanted to unpick that. And this summarizes the findings of our heat and health series. So if anybody's interested in this particular work, I'd encourage them to look this up. It's open access, freely available. And so, and if anybody has any questions about this afterwards, I'll be happy to field any questions. I've mentioned the Heat Watch app. So once again, there's the QR code. As I was mentioning, this was a pilot study that we've been running this past summer. Our funding has been completed with the New South Wales government, and we'll be seeking further support from the National Health and Medical Research Council to extend this project across the nation, hopefully starting next year. And so that is the end of my slide deck. But I'd be happy to take any other questions, either, I don't know if they're in the chat or if somebody wants to speak up and ask any questions.
Hi everyone, sorry, the internet at WACOSS has just completely gone down, so we're all frantically running around trying to hotspot our phones. So apologies for that timing, Ollie. Rachel should be back shortly.
That's no problem.
I can't see the chat because it refreshed itself when I've logged back in. So there weren't any further questions that I've seen, but I believe Rachel's almost logged back in. So apologies for that. But if anyone else has any questions, please feel free to pop it in the chat and I'll just step in for Rachel in the interim.
Hi, everybody. Hopefully we haven't lost you all. Thank you for bearing with us. I'm just checking that, Greg, you are still with us?
I am.
Fantastic, thank you. Hi, so I'd like to introduce Dr. Greg Martin, who's the Associate Dean Research at Murdoch University School of Law and Criminology. Greg is going to talk to us about civil rights and corporate interests. He is an interdisciplinary researcher working across law and criminology. He has published widely on topics ranging from organised crime, protest policing, immigration and asylum seekers, and legal secrecy. His most recent book, Social Movements and Protest Politics, introduces readers to the concept of post-protest society wherein the right to protest is whittled away to near vanishing point, and authorities have considerable legal recourse to ban protests and render the tactics of protest movements ineffective. Welcome, Greg, and thank you for joining us this afternoon.
Thanks, Rachel, and thanks to everybody at WACOSS for the work that they've done up to now and the scrabbling around to get everything back online. I'm at Murdoch University, and I'd just like to acknowledge that I'm on the land of the Whadjuk people of the Noongar Nation, and who are the traditional owners of the land, and I pay my respects to their elders. My title isn't quite what Rachel has said, but it is related to the protest stuff. So what I want to do today, I don't have any slides, so I'm just going to talk. I'm teaching in about an hour, and I'll have a lot of slides then. So I just thought I'd just talk free range here. I just want to talk in fairly sort of broad terms about some of the developments that have occurred in recent years in relation to policing of protest and rights, and the policing of protest rights. So a lot of my work is cross-jurisdictional, so I'll look at things that are going on in Australia, but also in the UK as well. So I'm just going to provide some sort of broad brushstroke sort of themes and comments and ideas and information, and that will be interspersed with some case studies and examples. So the first thing to note is that the right to protest is not a standalone right, and a lot of people don't actually know that. It's actually an amalgamation of free speech rights and freedom of public assembly rights. The other thing to remember as well is that the right to protest, as it's an amalgamated right in terms of those two elements, is not absolute. So it is limited. It is subject to reasonable limits that are within the framework of a democratic society. A good example of the limits on protest was 2020 in Queensland, the case of Queensland and Sri. The protesters there held a static sit-down protest on Story Bridge in Brisbane, and the Supreme Court held that that actually was an illegitimate protest because it interfered with the rights of other road users and their freedom of movement, and that was under the Human Rights Act in Queensland, Section 19. So that sort of raises the issue as well about protest rights being incorporated into statute law, legislation in other words. There are several instances of this in Australia. Queensland, as just mentioned, has a Human Rights Act. Victoria has a Charter of Rights and Human Rights and Responsibilities. The ACT also has a Human Rights Act. That peaceful assemblies are also regulated in legislation. Queensland has a Peaceful Assemblies Act. New South Wales has a Summary Offences Act, and in Western Australia, where I am at the moment, there's a Public Order in the Streets Act. All of these, essentially what these pieces of legislation do is they require protesters to seek permission with police commissioners or police forces organisations in order to hold a protest. So in the sort of literature that's sort of talked about in terms of the application for protest permits. So there is this built into the legislation, this notion of what's called in the literature negotiated management of protest, where police and protesters enter into negotiations with each other in order to work out things like protest numbers, protest routes, and those sorts of things. One of the things that I've noted in my work, however, is that often police don't adhere to those, even if there's a sort of court ruling, they often won't adhere to the rulings. So one of the things I've sort of talked about is how this is very much a sort of negotiated protest management of protest, very much a legal fiction. It sort of gainsays the distinction between law on the books and law in action. That's what we talk about it in terms of critical legal studies. I'll provide a better example of that. Actually, I'll do it now. I mean, a good example of that was the Sarah Everard vigil in March 2021 in the UK in Clapham Common. The UK High Court advised the Metropolitan Police Service to engage with Reclaim These Streets protesters around the organisation of that vigil and to negotiate in good faith. The police ignored that instruction. So there's a good example of how there's a distinction between law on the books, the High Court ruling, and the law in action, how the police actually behave on the ground. And I talk about this in terms of the relative autonomy of police power in relation to protests. It's sort of like an extension of their use of discretion. Some of the interesting stuff around COVID-19 mass gatherings during COVID-19, particularly in New South Wales, the Supreme Court was engaged in a number of cases where sometimes it allowed protests to occur and sometimes it didn't. So that's something I've written quite a bit about as well. And the role of the courts, I mean, one of my sort of ideas in relation to this is that the courts have quite a key role in making these decisions. You know, they can and often are upholders, even during the COVID-19 pandemic, where things were pretty critical. Even during that period, the Supreme Court of New South Wales was an upholder of protest rights, particularly in periods where the virus was less prevalent and or where protesters took precautions like, you know, having COVID marshals and wearing masks and having hand sanitizer. Often the courts and, you know, the New South Wales Supreme Court's no exception will invoke Lang and ABC, which is a 1997 case, which basically was recognition that there's a right of freedom of political communication implied by the system of representative government under the Constitution, the Australian Constitution, that is. So that will often be a sort of key starting point for courts when they're making these kinds of decisions. But the point that I'm trying to make, I guess, in a fairly roundabout way, is that there is provision in statute and also there is common law, in other words, court-generated law around protest rights. So this is seen as a sort of really important cornerstone of democratic societies. So what I've argued in a lot of the things I've written about over the past 20 years or so around this is that there's been an increased criminalisation of dissent. So we've seen this with 9/11, for example. We've seen it with COVID. We saw it previously in 1999 with the Battle of Seattle, where protesters interrupted the World Trade Organization meetings. And I see this as sort of tied to what I call the political economy of protest, where business interests, and this probably goes to the title that Rachel was talking about, business interests are often privileged over protest rights. This is more, it's kind of starkly illustrated with lock-on offences that exist across Australia. So Queensland, Victoria, Tasmania, New Zealand, New South Wales all have offences for lock-on devices. So, you know, protesters that literally lock onto machinery, like, you know, related to wood harvesting and mining. There's nothing in WA, however. There's also a bit of policy transfer going on here as well. So the coronation of Charles III last year, that 6 anti-monarchist protesters were detained for 16 hours because apparently their luggage straps that they were carrying with them, which were actually being used to wrap up their placards, the police thought that they were going to be used to lock onto things and to disrupt the coronation. And interestingly, those provisions were provisions that came in under the Public Order Act 2023. They came into force just 4 days before the coronation. So they were almost sort of arguably introduced for that purpose. My work's also been tries to highlight historical parallels. So the suffragettes locked onto railings at Buckingham Palace. If they were to do that today, they would be subject to 6 months in prison and unlimited fines. There are also historical parallels around the Reclaim These Streets vigil that I talked about before at Clapham Common in March 2021. Police manhandle that turned violent ultimately, and you know, similar imagery that I've presented in things I've published, juxtaposing images of police handling women at that protest, and also heavy-handed policing of suffragettes outside Buckingham Palace. How am I doing for time? Do I have a couple of minutes? One of the things that I'm interested in is, you know, how these are basically focused around gender and race issues. You've got the sort of Black Lives Matter movement that sort of became resurgent during COVID. Interestingly, they also target police as well, the policing of women. So one of the things was at stake with the Sarah Everard vigil was safety of women in public and police disinterest in dealing with women's safety in public. Black Lives Matter was about, you know, racist policing and killing of black men in the US mainly, but it filtered across globally. And when those researchers demonstrate, not my research, but other people's researchers demonstrate that when police are the target, then potentially those protests can become more violent or heavy-handed, subject to heavy-handed policing. The most, thinking in terms of emergent issues, I mean, one of them, I think, you know, if we're thinking about it in terms of, you know, the policy transfer across from the UK is the things that are going on there, where, you know, the Policing Act basically gives police total control over protests, peaceful protests. So we're seeing this sort of thing creeping in. But often the rationalisation by the state to introduce these things is that these tactics are new. So my historical analysis just demonstrates that these tactics are not new. I've already mentioned the suffragettes locking onto railings at Buckingham Palace. There's not really much difference between that and what's been going on in other places. And also arguably Extinction Rebellion, Just Stop Oil, and some of the other environmental protests that are going on here, you know, are examples of a sort of continuation of a sort of tactical repertoire that's historically grounded. I think one of the things that really sort of sticks out for me about the environmental protest stuff, though, is that that's actually, instead of targeting police, race, gender, it's actually targeting the capitalist system. It's threatening the ontological security of the state itself as well. And I think that's why we're seeing a ramping up of legislation in relation to these disruptive tactics, increased fines, increased prison sentences, what in the US jurisprudence they call a chilling effect on protest. So it's getting harder and riskier to protest. Good example is 2023, South Australia. There was a disruption caused by Extinction Rebellion protesters abseiling down Morfett Street Bridge, causing traffic chaos. The next day, the state government introduced amendments to the Summary Offences Act, basically providing for 3 months imprisonment and up to $50,000 fines. So in a nutshell, in terms of thinking about emerging issues, what I'm arguing, and writing a book about this at the moment and have a journal article under review. Hopefully it's going to be published. What I'm arguing is that we're teetering on the precipice of a post-protest society where protest rights are being whittled away to near vanishing point, and attendant police powers are ramping up and increasing. So that's it.
Thank you. I've got two questions, which I'm gonna put them and then go to the panel, because I realise we're running a bit behind largely because of that technical issue we just had. But one
I
question.
have to teach in about 45 minutes as well.
Okay,
so
we'll be finished way by then. One question is, how do you compare in-person protests to forms of electronic online protests? And I'll add a little bit of editorial, particularly in terms of trying to achieve change. Yeah.
I mean, obviously, a lot of these things relate to physical protests. And it was interesting that during the COVID pandemic, people thought that everything would go online, protests would all go online, but actually people still wanted to go out and protest on the streets, as it were. Yeah, I mean, often protests operate in tandem, or there's a sort of combination of tactics that are used. There's online tactics that are used in order to gather people in a public space. There are, online tactics that are used to, letter writing campaigns and things like that as well. But often the online is used as a sort of means of, summoning up interest in a physical protest. I mean, it's the $1 million question, really, is what is the most effective way to protest? Some scholars argue that it's better to be embedded within the political system. Some people would argue that the disruptive protests of Extinction Rebellion are annoying people so much and disrupting people's lives that they're not, they're unlikely to change things, but have a sort of an opposite kind of effect. I mean, interestingly, the UK is going through a series of rail strikes for the past sort of 2 years. Some of the issues that have been going on there about aren't people fed up with it, but actually the public is still largely supportive, even though it disrupts their daily lives. So
that takes us to the other question, which is, what are your thoughts about the recent farmer protests in France and Germany?
I have to confess I haven't heard about them. Could you enlighten me about that?
From what I've seen, there's a whole lot of disruption, farmers taking over the streets, bringing in their tractors, I think, if I remember rightly, dumping heaps of manure in particular places, disruptive places.
Yeah. I mean, that again is a sort of historically that's happened, in the past as well. I mean, what seems to be happening, and this is why I use the post-protest society. Obviously, I'm not saying we live in a post-protest society, because obviously protest is still happening, but the state increasingly comes down hard on what it regards to be disruptive protests. So yeah, I mean, it's difficult to, think about the efficacy of that. It has to be often done in partnership with other strategies, negotiation and trade unionism and things like that.
Okay. Evan's just asked a question around, has there been any increase in reports or threats by anonymous groups and protests that might be violent or threatening because peaceful protests are ineffective? What are young people or disadvantaged people saying about the intergenerational difference between the 60s, 70s and now?
Right. Yeah, I mean, there is some research that says that protests, like the research that's been done on Black Lives Matter, says that if there's a degree of violent sort of dimension to it, then it can actually be effective in certain respects in winning over particular populations. And that's obviously the worry, that if protest gets closed down, that it can potentially go in that direction. Oh, I mean, a generational thing. I mean, there's a lot of stuff around about, you know, the apathy of young people and the lack of participation in the political process. But some of the research I've done around, particularly some of the stuff I did for the book around corporate protest and the protest around brands and things like that, demonstrates that young people, Gen Z, are quite interested in using their consumer power and their online consumer power, as well as their physical, to actually, you know, boycott certain brands or buy particular brands that, you know, are ethical and so forth. So I don't buy this sort of argument that young people are apathetic. But yeah, I mean, I've written stuff around intergenerational justice, around baby booms and things like that as well. And there is sometimes sort of clashes that go on there between those two generations.
Thank you. Thank you for your time today. Really appreciate it. And we'll let you go to...
I'll stick around for another couple of minutes. Yeah.
Okay. Fantastic.
But I've got to go soon. Yeah, thanks.
Yeah. As I said earlier, we're running out of time because of our issues, tech issues. But I'm just wondering, if there are any burning questions. But I did ask Lindsay one before. And what I thought I'd do is invite our presenters to just make any final comments, but to keep them fairly brief so we can let people go for their Friday afternoon.
Rachel, do you want me to just have a crack at that question very quickly? Look,
Yep.
So the big announcement late last year was great news that there'll be 100% funding from a combination of federal and state sources for public education in Western Australia. Huge announcement and great news. However, there's a few points we need to remember. One is, at the moment, it's only a statement of intent that's been signed. We don't know what the federal government's expectations, or if you want to be unkind, strings attached to that money will be. We don't know where it's intended that money might go. The next problem is, it's actually, unfortunately, still not 100%. It comes up at around 90, about 5% short. And the reason it comes up short is some of the money we know already goes to things like the School Curriculum Standards Authority, which is not just for public education, which is about 65% of education in WA. It's also for private and Catholic schools. It also allows the state government to write off capital depreciation as part of that figure. So that's not money that's really going to public education. And finally, there's some money that simply goes into the black box and we don't know where it goes. So let's hope we get clarity on that. Let's hope the agreement is signed. There is a great opportunity here because we know all the things we've talked about. A big part of the fundamental problem is the resources to do something about it. But I'd say, just caution, don't let's be conned. And I just thought I would add, as a comment about being conned, around about the same time, we got the great news that in Western Australia, education is striving ahead. WA and Australia moved up the international rankings in PISA, international sample testing. Unfortunately, in real terms, we did not move up. What actually happened was a bunch of other nations moved down in real terms, which gives us puts us up the ranking, but it doesn't mean things are getting better here. It means overall things are looking pretty rugged, not just here, but elsewhere. So we just need to be careful. And the only other thing I wanted to say is I really appreciated the opportunity. Thank you, Rachel, and everyone for the chance to join you. And I really I enjoyed all the other speakers, but naturally enough, I enjoyed particularly wherever there were synergies with what I came to say, and there was no shortage of them. So thank you very much.
Thank you very much, Lindsay. Libby, did you have any final comments you would like to make? And I do have a question. I have a question there if you want to have a go at it.
I'm happy to take more questions I know that we're up against time. So maybe Rachel, I'll just...
Yeah, go on.
Should I go into my closing remarks?
Yeah, and I'll give you a question on notice.
Perfect. And really what I wanted to say was it is such a pleasure to zoom in to WACOSS's forum, Emerging Issues Forum. We here at VCOSS often share your great ideas that are emerging in WA. And I think I'm going to report back to my team here in Victoria that we need to have an emerging issues forum because it brings together so many good ideas. So it's been a real pleasure to Zoom in tonight, and I'm happy to share my details. All of the topics that were discussed tonight, today are really, as Lindsay said, there's a lot of crossover and overlap, and so I'm just looking forward to continuing the conversation, and I'm happy to take a question on notice.
Thank you. And thank you very much for participating. I really enjoyed it. So the question is, how do departments work with community organisations to get bids up, and does ERC still need to approve the funding? So we can chat about that offline and then circulate the answers.
Absolutely. Thanks, Rachel. Bye.
Fantastic. Thank you. Do any of our other presenters want to make any final comments? Okay, it doesn't sound like they do. Thank you so much, everybody, for joining us. If you want to follow up any of the speakers or information that's been presented today, we will please contact us and we can provide any further information. We'll get the slide packs from people and make those available on our website. Recording of this has been made. We'll also obviously be making that available. If you have any questions, please reach out and we will do our best to follow them up. Thank you for joining us today. Just a quick ad, state budget is coming up and we'll be having our briefing like we usually do on the 10th of May. Thank you very much. Thank you to all our speakers, and we will see you all in the near future, I hope, in our continuing webinar series. Have a great weekend.